Hello and welcome to this Contact webinar. If there's a technical hitch, please do bear with us. And those of you joining by PC, laptop, tablet or smartphone, you should be able to see this introduction slide now. As there are so many attendees, you'll all remain muted throughout. If you'd like to ask a question, please ask a question through the question box on the GoToWebinar toolbar. This will allow you to put a question in the box and submit it to the administrator, and those questions will wing their way to me and we'll answer as many as we can along the way. There is some time at the end of the broadcast for some more question and answers. We'll hopefully get through as many as we can during the webinar. If there are any questions that we can't answer at the time, we'll collate those questions and they'll be circulated alongside the recording of the webinar. We're also trialing a couple of little polls that will be coming up at the end of the webinar. And there's also the short questionnaire at the end of the webinar, just to give us a bit of feedback about the webinar. So, introductions. I'm Lynn Hoppenbrowse. I'm the Strategic Health Lead at Contact, and part of my role is to support forums engaging with health. And we also have with us Ros Luff. I'll let you introduce yourself, Ros.
Hello there, I'm Ros Luff, Bromley Parent Voice, and I'm a parent carer. One of my children has autism and pathological demand avoidance.
And Mary Busk.
And I'm Mary Busk, Family Care Advisor at NHS England. I was previously involved with Parent Care Forum and part of the National Network of Parent Care Forums. I have a son as well with learning disability and autism, so really happy to be here today as part of this webinar.
So just a quick overview of what we're going to look at today. I'm going to give you a quick update as to what we're doing here today, the project that we've been working with NHS England and Mary. Ros is going to talk a little bit about learning disability registers. Then we're going to look at learning disability annual health checks, what they are, why they're important, and what might you expect whilst you're having one. And health action plans, which is a key outcome of an annual health check. And also linking them to the SEND reforms and education, health and care plans. And also Mary's going to talk a little bit about care, education and treatment reviews. And also something that we've been learning about as part of this project is actually what happens if this is not what you experience. So we've got a few key ideas as to what you can do if this is not what you experience at the end. Okay, so this project was a collaboration between Contact, the National Network of Parent Care Forums, and NHS England. And as part of this project, we're developing some guides and fact sheets to improve parent carers' knowledge about what annual health checks are and what the learning disability registers are and why they're important. But also as part of the project, we're also wanting to work with GPs so that they understand the needs of families with disabled children a little bit better, because it's one thing to give parent carers the information, but it's quite another thing if parent carers go to the GP and they don't get the answers that they think they're expecting. And hopefully what we're hoping to achieve, as is the case with many projects, we're probably going to come up with more questions than answers. So we're wanting feedback from everybody listening as well about what happens when you ask your GP. So we want to be able to feedback to NHS England whether there are any initial barriers to getting a learning disability health check or being on the learning disability register. Now I'm going to hand over to Ros to talk a little bit about learning disability registers.
Hi there. Yes, the learning disability registers are the record registered with GPs of people that have a learning disability, but it is a voluntary register. GPs don't have to hold them. Many of them do, and we're trying to encourage everyone, every GP to hold these. You can still ask your GP if you can access a health check. Since 2015, the register should include all ages and not just those over 18. And it's something to start thinking about perhaps in the preparing for adulthood stages of when you're looking at EHC plans. All of those that are on the register over the age of 14 should be offered that annual health check. But as I say, you may have to prompt for that to happen. Have the next slide, please, Lynn. So who should be on the learning disability register? Well, that's anyone that has a learning disability, regardless of whether they have a diagnosis of learning disability, that can go and ask for it. And there is some confusion around that because often people aren't diagnosed with a primary diagnosis of learning disability. It may be something else. If your child is under 16, you can ask for them to be added. If your child's over 16, they may have to ask for themselves, or you could have a conversation with their GP. And the first step would be to have that conversation with your GP, because not all children and young people who have a learning disability may have that specific diagnosis that I mentioned. They may have other disabilities. But basically, if in doubt, ask. There's no harm in asking. Can we have the next slide, Lee? So the benefits of being on a learning disability register. First of all, it enables the practice staff to identify children, young people, the families who they may need to make more reasonable adjustments and may need extra support. And that's even if you don't end up having that health check. It's just good practice to learn about those young people and how things arise for them. It helps the GPs and practice staff understand the complexities for those children, young people, because often they're under a specialist provision, a specialist consultant, and maybe the GPs haven't seen the children. And it helps identify the wider holistic circle, the parents, carers, siblings, the wider network around that child, and making sure that they remain healthy too. May help to improve the transition to adult services, as your GP will be aware of child's needs, and he can be or she can be supportive in helping plan the other services that your child may need to access as they become an adult. And the next slide, please, Lynn. So reasonable adjustments, this is a legal requirement, and it's something that lots of people struggle with. They think disability, think ramps, but not necessarily what a reasonable adjustment looks like. We have some examples here, like having a quiet waiting room, making sure there is that wheelchair access, providing easy read appointment letters, giving someone a priority appointment if they find it difficult waiting, longer appointments if someone needs more time to explain their condition and things. And there's lots of different ways and inventive ways people can be make adjustments. The contacts are make a guide on how GPs practices can be more accessible. There's things such as maybe having an appointment and the receptionist texting you to say that the doctor's ready to see you, so you can sit outside in a car, or even in some instances the GP may be happy to visit you in the home. Next slide, please, Lynn.
We're over to Mary now for a definition of learning disability.
We thought that as we're talking about learning disability in relation to annual health checks, that we should cover and understand what we mean by a learning disability. And I think that we all probably know that sometimes language is used differently between education, health and social care. So it's important to understand that there is this recognised term of a learning disability. That term is now changing to be known in terms of diagnosis as an intellectual disability, and it requires it means that someone has difficulties from birth of understanding complex information, not being able to cope independently, and it starts before adulthood and has a lasting impact on development. I think a lot of people, and I have to remind colleagues and others of this, I talk a lot about this, that learning disability, intellectual disability isn't just one thing, it's actually 4 different things. And the needs of each of the groups within each of these categories of need is actually quite different, both in terms of, the way that they will be able to interact with the world. So, for example, in NHS England, I work with colleagues who have a learning disability, and they have a mild learning disability. So they're actually working with me as colleagues, doing a fantastic job. Those with my son, there's also a category of moderate learning disability. My son has a severe learning disability, and in terms of how that affects him, he's actually unable to read. He also has autism. He has difficulty understanding spoken language and speaking. So the impact on somebody with a severe learning disability will be greater. And not that still we can't hope and have high aspirations for everybody. And then those with profound and multiple learning disabilities will also have a lot of often a lot of complex health issues. So it's really important to understand what the language means, to understand there are 4 different types, to understand that education may refer to it as something different, and that's okay, so long as we also all know that that in health, in terms of the diagnosis and the disability, it is a learning disability and intellectual disability. And there are some new frameworks to try and help practitioners to identify those with an intellectual disability that parents may be interested in. And we've got one of these in a link at the bottom of the page. I was involved in helping to develop this. I think it's really important.
And it's interesting to know that if we find it confusing, I think practitioners also find it confusing. And I think that's one of the things that we're learning from this project, is that the confusion around the definition of learning disability, it's not just parent carers that find it that confusing, practitioners also find it confusing.
That's right, Lynn. So just move on to the next slide.
This one's you, Mary.
Oh, it's me. Okay, sorry, Lynn. So annual health checks then are for anybody on the learning disability registry aged 14 and over. And you can be very proactive if you haven't heard anything. Talk to your GP about it. They certainly all should be very aware of this and willing to help and give you advice. And obviously you've got this great webinar as well as a source of information to point people to if they need any help or guidance. So the aim of annual health checks was to minimise health inequalities that many people with learning disabilities face. And we'll talk a little bit more about that, but it's been absolutely recognised that there is avoidable and premature death, and people with learning disabilities, children and adults, will struggle to access health and other services because of their learning disabilities and perhaps the lack of understanding and the lack of reasonable adjustments. It's also interesting and relevant that the Education, Health and Care Plan reviews, obviously that being something that incorporates health, includes a focus on preparing for adulthood, and we could see included in that annual health checks as a health outcome. That would seem a very reasonable and important thing to do. There is also some really good guidance from the Royal College of GPs and a pre-health check questionnaire that can be used by families as well. I'll just move on, Lynn. So I mentioned a little bit about health inequalities, and these arise, they can arise from unmet or unidentified needs, and you may already know of these yourselves from your own experiences or from talking to other families or people. And they can arise from difficulties understanding or communicating health needs, difficulties accessing healthcare because of lack of reasonable adjustments, or sometimes symptoms being overlooked or attributed to the learning disability, in particular if there might be behaviours and so on. So, for example, somebody like my son with a severe learning disability, he will not be able to indicate pain. He will not indicate that he has any problems. So it's very much for him about, you know, treating him and looking after him as though he's a much younger child, even though he's now 19. Leader, the learning from deaths work, and we've put the links to this work in the points below. This is a really important piece of work that's been led by the University of Bristol, but NHS England commissioned it, and they've just published a recent report in response to the latest leader report from Bristol about analysing the reasons why people unfortunately are dying prematurely and what we can learn from that. And there's an absolute commitment to supporting improvements in the quality of health and social care delivery and reducing premature mortality and health inequalities, because these are all preventable things. They are caused by the fact that somebody has a learning disability and for no other reason. And really from all of this, in one of the previous reports from Leader, not this one, but the last one, it was recognised that there is a need for mandatory training for all health and all social care staff in learning disability and autism to help also contribute to and help reduce these inequalities and premature mortality. So that's another response to addressing these really serious and important issues. I'll move on, Lynn.
Okay, we're over to Ros.
Hello again. So the benefits of having the annual health check, your child or young person can build confidence and familiarity with the practice staff and going to the surgery. And that's very important, that if your child is suddenly taken ill, that it takes away all that fear and anxiety about being in the surgery that can be piled on top of things. It allows the doctor to get to know your child when they're not feeling unwell, so they get to know how they communicate and what things they like, what they don't like in the way they're approached. It helps with the it helps to identify the unmet health needs, and often, again, if a child is under a specialist, they may only be looking at their specialism and not picking up other health issues. Health needs are then acted upon and referrals to the other healthcare professionals can take place. And it offers an opportunity for your young person and for you to talk to the doctor about anything that's worrying you. And that information can be added to your young person's summary care record, but I'll pass over to Lynn and Mary for more information on those.
Okay, so I'm going to talk a little bit about summary care records. If you don't already know, everybody has a summary care record. We all have one unless you opted out of it specifically. What that is, it basically just contains some very basic information about you, allergies, medication, and the main information about yourself, so name, address, date of birth and NHS number. And it allows other practitioners to access that basic information from any other NHS services. So, for example, when you go on holiday and you need to go to a GP, they should have that basic information about you. But you can also ask to have additional information added to yours or your child's summary care record. So things like medical history, reasons for medication that might be, just listing medication doesn't always give the information. And perhaps information about the management of long-term conditions, the what to do if. And also, as we were talking before, and Ros was talking about reasonable adjustments. So where there are any possible issues about going to see somebody in a health setting, any reasonable adjustments that might be needed can be put on your summary care records. And they are working towards having flagging systems so that anybody that accesses that record will see what those reasonable adjustments are needed. And another thing that I'm just about to talk about is about communication and support needs. So this is from the Accessible Information Standards. And since 2016, all organisations have to follow the Accessible Information Standards. That is linked through to the Accessible Information Standards. And what this actually means is it's basically there is a duty on NHS care and social care providers to understand what those communication needs are, documenting them, making sure that they are very clearly visible to anybody else that sees that person, and also sharing that information about those communication needs. So it goes back to what we were talking about, reasonable adjustments. It's about whether there are any communication needs, if they need longer to process information, so we'll need longer appointments, or perhaps need easy read information, or even with some of our children where they're not verbal and how they might communicate. So if they use symbols, or if they use a communication board, or if it will highlight whatever those communication needs are. And a very simple one about meeting the needs is providing interpreters, or providing a BSL interpreter for somebody who's deaf. And these are things that can also be added to that summary care record, so that everybody that sees your child knows about these needs before they even see them. So back to the annual health checks, and just going to run through on the next few slides what to expect. This is what you should expect. This may not be what you have experienced, but if we run through what should happen, we can then look at what might happen. So depending on your GP surgery, the health checks might be done by practice nurses, a GP, or both in some instances. Sometimes you might be asked to prepare for an annual health check, and actually this is probably a good thing to actually do, is think about what you're wanting to achieve from an annual health check before you go. You could take some notes with you, or I've got a couple of examples of some pre-questionnaires. This is one from the Royal College of GPs, and as you can see, it's using symbols, it's all in easy read language, and this is only a snapshot of it. There's lots of pages that give you lots of information, which will give that whole view and holistic view of the person. There's another one that was produced by a paediatrician to help parent carers when going for appointments. I quite like this one because it's just basically tick box with some space for you to write problems or issues that you want to discuss. And I think as well, by preparing before you go, you can think about what might be problematic during the health check, and we'll go through what to expect during a health check as well. So this is basically a list of what might happen during an annual health check. It's the usual physical check, heart rate, blood pressure, weight, all of the usual things that we'll all expect to happen when we go to see the GP. But there are some specifics, so things that people with learning disabilities often have problems with, such as epilepsy, constipation, problems with swallowing. Looking at medication, reviewing medication to make sure that they're appropriate, and any other existing health problems. And this, I think, is a good point to look at coordinating all of those other health appointments. If you're going to lots of different appointments, sometimes it can feel a little bit as though nobody's actually putting the whole thing together, and this would be a good opportunity to discuss all of those issues that you might have got conflicting advice from two different appointments. Again, as we've talked about, transition to adult services. When you get to adult services, your GP will be one of those key players in your child's care, because they are the ones that essentially take over from paediatricians. You don't have the equivalent of a paediatrician when you get to adult services, so your GP essentially becomes that key person. So this is not an exhaustive list. There will probably be specifics to your own children and young people that are around their condition and what specifically they have issues with. But this would, it's good to have a think about whether there's going to be any problems with any of these bits of the health check. For example, taking blood. Does your child or young person have a particular problem with taking blood? There are lots of adults that have problems with taking blood. And also the simplistic things. Is your child or young person going to be able to sit through this length of check, or is it going to be something that you're probably going to be better doing in short bite-sized chunks? So don't assume that this is exhaustive, but it's just there to give you an outline of some of the things that they'll cover during an annual health check. What to expect as an outcome of an annual health check. Something that we're hearing quite a lot as part of this project, that the people that have been and had an annual health check often feels a bit like a tick box exercise, and they come away thinking, well, what was the point of that? You're supposed to receive a health action plan as a result of an annual health check. And basically, a health action plan means that it's what you, your child, the GP, and any other health practitioners need to do in order to keep your child healthy. It's just a care plan that tells everybody what they should be doing. These can be, we'll talk a little bit more about the link to EHC plan reviews, but this is the bit of the annual health check that can specifically link into EHC plan reviews, especially where there's from year 9, from age 14, when there should be a focus on preparing for adulthood. If your child is able to understand their own health, and it's appropriate to teach them about how to stay healthy, that's another area where the health action plan can actually be quite useful, because it can document some specific areas of work that your child or young person might work on in order to improve their knowledge about health. Because obviously it's as much about them looking after themselves as much as they possibly can as well. And also it could be used to improve the coordination of care, particularly if you've got lots of people involved in your child or young person's care. It could be a place to list all of those specific people, who they are, what they do, and what their role is. So, which will enable you to have that in one place that you can then share with other people. And we've got an example. This again is from the Royal College of GPs toolkit that is linked there at the bottom, and you can see an idea of what it is that they will be, what they'll look like when they're done. Now, and just a point to remind is GPs have a format, computerized format now that goes through all of the annual health check elements, and actually the health action plan should be automatically populated as they go along, and you should then get a printout of this health action plan at the end. What we're hearing though is that often doesn't happen, but by knowing that there's a health action plan is supposed to be an outcome, you can ask, where is your health action plan? What can we sit and discuss it? Can we put it together? And this is another example of from the website Easy Health. That has lots of easy read leaflets about lots of health subjects. So again, this is another idea of a health action plan. So identified health issues, what we're going to do about them, who does them, and by when. So we said about the link to education, health and care plans. So SEN Code of Practice, EHCP reviews from year 9 must have a focus on preparing for adulthood. And that should include support in maintaining good health in adult life, including transition, and including planning with health services about who they're going to go to from children's health services to adult health services. So back to the health action plan. If you get a health action plan, that can essentially just be inserted into the education, health and care plan, and that then meets the health outcome for preparing for adulthood. Obviously, there are other elements to preparing for adulthood, but it's one of those areas where I think it can often feel like you're replicating things, whereas actually you can just use that health action plan to be added into the EHC plea, so it's not duplicating at all. And I'm now going to pass over to Mary to talk a little bit about care education and treatment reviews.
Yes, so I'm very conscious that there are a lot of acronyms and all these different words, but what we're trying to do today is to bring a lot of issues together that you may hear about and should really be joined up in relation to how these issues are discussed in your local area, and families and people and children and young people are kept informed about what's going on and how things work together. So in talking about care education and treatment reviews, that's something really important for parent care forums, families and children and young people to know about if it's something that it impacts on them. So while health checks are available and necessary for all children and young people and adults with a learning disability, care education and treatment reviews are for those who maybe are at risk of being admitted to a specialist mental health or learning disability hospital because they have needs that cannot be met in their local area around their mental health. So there is a process, and we've provided the links to these processes, the policies and a webinar about how this is supposed to work. And again, if you've got feedback and that this is something you'd like more about, then perhaps you could let us know at the end. But I was actually helped to develop the care education and treatment review policy, and there is a policy for adults called care and treatment reviews. They're really designed to bring external challenge into the system. So they are chaired by the local commissioner, health commissioner, but bring an independent clinical specialist and independent expert by experience in to sit down with the family, the child, the person, to say, either whether at risk of going into a specialist mental health hospital, is this really necessary? Can we not support this person and their family in the community? And it looks across education, health and social care. So we are, when we were reviewing the policy and looking at the adult policy, which is the care and treatment review policy, we actually specifically wanted to put in education. So that's why the children and young people, it's the care education and treatment review, CETRs, because every child has a right to a good education and to have aspirations and to have a good life. So although this policy, as you will see, has been written by the NHS and by my colleagues in NHS England, these are actually policies that have to be implemented in local areas by local authorities, education services and clinical commissioning groups. And these are the people who need to administer and organise the CETR process, and to ensure that people have good lives and the right education and support regardless of their level of needs. The care, education and treatment reviews are very much based on the principles of human rights, child and young people centeredness and co-production. And I think we've introduced them because, again, it's important to understand the links and think about the links between physical health issues that can sometimes affect behaviour. So I've known and heard, for example, from colleagues in the voluntary sector and elsewhere that, for example, the work by Seeability on eye care and eye health for children and young people with learning disabilities and wider, that sometimes behavioural issues can actually be caused by, for example, poor eyesight or poor eye care and not having the right support in that area, Or it might be in the case of, for example, my son, he had issues, a lot of problems when he was young with ear infections and chest infections. And sometimes we're linked to these issues that we've raised before about, you know, the health inequalities, and also sometimes called diagnostic overshadowing, where people don't see the health conditions but just see, you know, a person with complex needs who has a learning disability. Sometimes, unfortunately, things can be missed. So it's really important to use all these opportunities through the annual health check process, through that dialogue with your GP and other health practitioners, because obviously that the annual health check could also involve in making referrals to other health practitioners to investigate physical health issues that you may be concerned about, or your young person may be concerned about. So it's really important that all these opportunities are used so that if there are issues that, you know, may be affecting behaviour, but with the right care and support and understanding and the right investigations for physical health needs and treatment for those, there would be no need to for anybody to be going out of area to specialist mental health hospitals for issues that are not related to mental health at all, but simply related to behaviour caused by you know, an undiagnosed or an unmet physical health need. So that was why we introduced this information and the links to understanding and being very clear about the importance of physical health needs and not having them attributed to behaviour or challenging behaviour. Thanks, Lynn.
Hi, I'm just reading a couple of questions now. I'm just going to move on to the next slide, but pause briefly just to look at some questions. Now we've got one from Agnieszka, have I pronounced that right? Why are EHCPs not pushing for everyone to have a health action plan? I feel like there is no health for young kids. The difficulty with that one, I'll give a little bit of a brief answer, and then maybe Mary, you can follow up as well. You might know a little bit more information than I do. I think that the issue is that the annual health checks are only for children and young people 14 and over. And I kind of get your question, Agnieszka, why isn't everyone having an annual health check? And I think the assumption there is that paediatricians do the equivalent of an annual health check with people, with any children that are on their register. But again, it is a good question. Why don't younger children have a health action plan that pulls all those health issues together that can simply be inserted into their education, health and care plan? It's a good question, and one that we probably can't answer very well. Mary?
Yes, I mean, I think it is a really good question, and certainly I would encourage you to, you know, make sure that all health issues are discussed as part of your annual review for your education, health and care plan, or if you don't have an education, health and care plan, you know, whatever annual, you know, whatever the annual reviews are, because the whole essence of the Children and Families Act, it was based on education, health and social care working together. And certainly, you know, even before my son had an annual health check, I had asked for health issues to be written into the health parts of my son's education, health and care plan around, you know, his need for orthotics, his need for boots. I'd even got, you know, the issue about blood tests in there, preventative dental care. So I think I would encourage you to discuss openly, you know, have a discussion about health issues as part of these annual reviews, and because it is an education, health and care plan. It is an education, health and care plan process, you know, education, health and care process. And I think we need to have more debate and discussion and inclusion of these issues. And it's also very relevant actually to the whole issue of joint commissioning, because if it's the case that, you know, your young person is struggling to get, you know, a service or some help, that they need from the health services or the health system and they can't, then that is something that should be being fed in through your feedback and through these annual processes, or through the local offer, so that it can be commissioned. So I'm all for having open and frank and inclusive debates about all health issues, and where necessary, writing those into education, health and care plans, but certainly, having it recorded and having a debate, and making sure these issues are raised with commissioners and others.
And I guess the other thing to add in is there's no reason why you can't use one of these template health action plans, or even the questionnaires that we've shown for a younger child. One of those questionnaires, the one that was produced by a paediatrician, was produced for all children, which basically just covers all of the elements of health generally. And there's no reason why you can't take those and say, could I have something like this? If you go to a paediatrician, or if you see a paediatrician regularly, or any other health practitioner, could we look at doing a health action plan so we are clear about who's doing what? It's only about good communication, really, and then that then gives a way of putting that health information into an EHCP, or also to school.
I think that's right, Lynn. I think that's right. And just to add on to that, I mean, these annual health checks have come about because of the significant preventable health inequalities. So people with learning disability will die about up to 30 years before their peers for preventable health reasons. So I think it was because of the significance of the health inequalities. That's why they were introduced for, young children, young people over 14, and adults with a learning disability. Within the NHS long-term plan, there is also a proposal to trial these for young autistic people. And I can't say any more than that. We could perhaps maybe put a link into that as part of the, the information from the webinar today. But that's something to look out for, that they're also looking at doing this for autistic children and young people and adults as well.
Yeah.
Can I just sort of chip in something here as well? When we were doing the focus group with some GPs, there was they did say that even if you're not eligible for the annual health check, there's nothing to stop you from seeing with your GP practice. We'll see your child on a regular basis to build up that confidence.
No, and that's something I think that's something that Contact particularly feels is good practice, is actually make the time to build up that relationship with your GP, because although when your children are under other health practitioners, it's often easier and simpler to go straight to those other health practitioners, but actually your GP is a key member of that health team. And just one thing to remember when it comes to your GP is every single letter that you get about your child or young person also goes to your GP. So they're almost the only other person that has all of the information. Okay, so we've got another question from Catherine around, can a hospital use a health action plan for transition to adult services? And yes is the simple answer to that one. I think in the resources slide at the end of the webinar, there is a link to the Council for Disabled Children, and they have some really useful health passports. They're slightly different to the health action plans, but they're ultimately doing the same job, that it's basically detailing all of the information about all of the health issues and who's responsible and what's supposed to be being done. And the same with the health passport. The health passports are more your information giving to the hospital, so it's about what your child or young person needs when they're in hospital, how they communicate, how they show their likes and dislikes, those kinds of things. But essentially they can be interchangeable, I would say. And actually the health action plan around transition should definitely include things about transition from one hospital to another, or from children's services in one hospital to another. I don't know whether either of you have got anything else to add to that.
No, not me.
No, yeah, no, I think that you're right to raise transition. I think there's now a big focus on transition. You know, there have been a lot of reports about how it needs to be made better. I remember being involved when I was part of the national network in one called, it was the Care Quality Commission from the Pond to the Sea. And there's been a recent big research study that's just reported, you know, talking about the importance of communication with families, open communication. So I think I agree with everything that Lynn said. And I think it's also important that, you know, there's clarity, you know, there's no gaps there, you know, there's no, you know, that practitioners take responsibility for ensuring continuity of care, and that, you know, the GP is informed about all that's going on, so that, you know, they can have a role in you know, in talking about, you know, any issues or questions you might have when you actually then, you know, go to take part in the annual health check.
And we've got another question from Catherine about would a review work for young people who have complex medical issues and autism? And I think you've partially answered that one, Mary, around the fact that that NHS England is looking at some autism specific annual health checks, but certainly in terms of the complex medical issues, the annual health check should definitely be relevant for children with complex health issues.
No, absolutely. And I think, as Lynn said, you know, there's no reason why, you know, if a child or young person has complex health issues and autism, but maybe does not have a learning disability, then, you know, certainly this is good practice. You know, it's something that, you know, it's good. It's a good thing to do. And as Ros was saying, you know, we were even talking at the wonderful event we had in Bromley with GPs and families about how actually, you know, going and seeing the GP and talking about current issues or worries is perfectly, you know, reasonable when you have young people and children with, you know, a range of complex needs. It could be, I mean, there's a question always about, you know, do you feel that all your child's needs have been identified? So is there a possibility that with the autism and complex needs, there might also be a learning disability? There may be, you know, a learning difficulty identified through the SEND process, but that's another question just to think about, you know, perhaps with your GP or other health practitioners, you know, have all the health needs been met? Is there perhaps also a learning disability or an intellectual disability? And then, as Lynn said, you know, there is commitment, an absolute commitment in the NHS long-term plan, the current plan, to look at trialling these for those with young people, children and young people with autism as well.
Thank you, Mary. I'm just going to run through some of the points about what to do if your GP doesn't offer annual health checks, or you have a discussion about the learning disability register, because I think it covers some of the issues and the questions that we've had in as well. So if your child, I think probably one of the triggers might be you're either going to be proactive and go to your GP surgery and ask, but one of the other trigger might be that they're over 14 and you've never heard of an annual health check. So probably your first step would be to check with your GP that they are on the learning disability register. And there are some issues around who goes on learning disability registers, and it is sometimes about a conversation with your GP that actually you think that they need to go on the learning disability register, and then you can have a conversation about the why and the what it will achieve. But always remembering that the reason that these things are in place is because of those health inequalities. It's one of those things that I think is quite difficult for parents to think about and talk about, but actually the fact that we know those health inequalities exist. We know that people with learning disabilities suffer with health issues that they don't necessarily have to, because in every other member of the population they would get addressed. So it is about identifying those needs as soon as possible. So if you've got a GP practice that they're on the learning disability register, but they don't do annual health checks, because GPs don't have to. Most of them do, but they don't have to. If your GP is unable to offer one, ask them whether there's somebody local, another GP surgery locally that you can have it done at, because most GPs now work closely with other GPs in the area, and I think we're going to see more and more GPs working closer together in what are likely to be called networks. So you'll probably find that your GP surgery is going to start working a bit more closely with other GPs in the local area. They might not be the nearest GP surgeries. They may be GPs with similar patient lists or whatever, but they will be working much more closely together. If you still can't get an annual health check, I'm hoping that a GP wouldn't be that forceful about saying no, because they know they should be doing these, that you can contact your local learning disability team. Most areas will have a community team, a community learning disability team, and there's a link on the resources slide at the end that takes you through to search for your local learning disability team. And even if they are just an adult service, they should still be able to help you find a local GP who offers annual health checks. And really, another option that you can do, which is not one that we'd necessarily want to do as a first step, was if your GP won't offer the annual health checks, won't help you find somewhere that does one, the other option is to move to a surgery that does. And there, again, there's some information on the resources slide about what to do about changing your GP. Also, as part of this project, we're developing a guide aimed at GPs and practice staff about what they can do to make practices more welcoming. What we can do, as soon as all of this gets uploaded onto our website, we can link you into those guides that actually would be worthwhile taken with you to your GP, so you can open up that conversation. And I think a lot of this is mostly about communication, and if you don't know, it's the usual, you don't know what you don't know. If you don't know about annual health checks, and if you don't know about learning disability registers, how are you ever going to ask? Whereas at least if you know about them and you can ask about them, you can then have that conversation about, well, I think my child should be on the learning disability register because they have difficulties with this and this. And the other thing that you can do is just have a conversation with your surgery's practice manager, or most surgeries will have patient reference groups. So they're kind of the parent participation version of GP surgeries. So most surgeries will have this patient reference group, and you can go and talk to the people. You can get put in touch with the people that are part of that patient reference group, which again is all to do with feedback, gathering feedback from the users of the service and improving that service. So if you're struggling with your GP practice, then that would be another route that you can go to. And Mary has been specifically involved in an initiative at NHS England around compliments, complaints and raising concerns. So I'm going to pass over to Mary to talk a little bit about that.
Yes, thanks, Lynn. So we've put the links in here so you can find more information about what we've been doing, but it's a piece of work called Ask, Listen, Do, and it sort of reflects, I think, the fact that the lifetime of a person with a learning disability, autism or both, in education, health and social care, from childhood to adulthood, can be complex and can give rise to different challenges at different points in the system, whether it be around getting timely diagnoses or getting the right therapeutic support, finding the right school and support, getting the right short breaks and other services, then transition and all of that working well and properly. So Ask, Listen, Do came about because families actually came to talk to NHS England to say that those who had learning disability and autism to say, with children and young people with learning disability and autism, to say they didn't feel listened to as families or people, and their voices were ignored. So it's really important, and hopefully we've given you tools here today that you are able to get your message across, so that people who manage work in a commissioned services understand what carers and people are actually saying. And there are different ways of doing this, through feedback. So that can be, direct to practitioners, in conversation with your, GP reception staff or your GP, through raising concerns, which don't have to be in writing, about, could be lack of reasonable adjustments, or, the need to get maybe more timely healthcare or services, or, social care support. Or if sometimes if people don't listen to those things, where people are able to, they may have to make a complaint, which then follows legal processes. And with working closely with services throughout your young person's life, it can be difficult to navigate these complex pathways, as well as seeking to advocate really through feedback, concerns, or sometimes complaints. So it can be difficult because of the time involved in all of this, because you may be worried or concerned, but it's your absolute right to be heard, and for your young person's right to be heard. So we've been working with 9 other national partners, including Ofsted, Care Quality Commission, Department for Education, on this initiative called Ask, Listen, Do, to help ensure that organisations get better at listening and acting on what you say, and that includes all health organisations and all education, all schools. We've developed some resources with Whole School Send for schools, and also social care that includes social workers and other organisations, the local authority, clinical commissioning group, all of those organisations. And also we want people and families to be empowered to have your voices heard. We've put the link on here to the top tips for families and carers. That was co-produced through working with families and groups, including Contact, just to talk about these issues. And I think sometimes people maybe don't understand the difference between feedback, concerns, or complaints, or that when you're talking about something or giving some feedback, that it's important people listen and do something about that. So those are resources to help you, hopefully, if you haven't already, understand you have an absolute right to be heard, find your voice, and feel brave to go and talk about these things. There'll be more things developing on this, and Ofsted have just written a really good blog for us. So if you're interested in any of that, do ask, contact and Lynn, and we can get that out to you as well. Brilliant. Thanks, Lynn.
And on the subject of getting your voice heard, we want to hear from you. So we've got a couple of polls to ask you. So if we could launch poll 1, whilst I go on to the next slide. So we want to hear from you about what actually happens beyond this webinar, whether you go to your GP, whether you ask to be on the Learning Disability Register, whether you ask for an annual health check. We want to know what happened, how it was taken, whether you actually achieved getting an annual health check and a health action plan. We just want the feedback around what actually happens.
Okay, then. So I can let you know that 92% of our audience have voted, and of that 91% have said yes, and just 9% have said they're not sure.
I'm not surprised. So can we go with poll 2? And whilst we're doing that, I'll go back to the questions. And we've got another question from Agnieszka. I'm really sorry if I'm pronouncing it wrong. We've had an EHC for years. Unfortunately, he's scared of his GP. And I think at 14, it'll be too late. I think my response to that would be, I think if it's just one GP, perhaps there's maybe ways that you can see a different GP in the practice. But all of it shouldn't necessarily prevent you going to see your GP and asking for an annual health check. I think that's part and parcel of what the annual health check is there to address. If there are issues about going to see a GP, then they need to be discussed and looked at, and find the ways round, those ways round. And as Ros said at the very beginning, and maybe I'll bring Ros back in here because I know she's had some experience with some parents that have had annual health checks. I think, Ros, correct me if I'm wrong, but you know of some people that have had annual health checks where the GP has come to the house?
That's right. With the or it was the learning disabled nurses. I'm not too sure which team it was, but they arranged to come to the house because there was absolutely no way the child was going to go to the surgery. There was too much anxiety around just being physically in the surgery building, and they successfully managed to do a blood pressure check at home because of the relaxed environment. And really, I know you said it's 14 plus, but they say about preparing for adulthood, it's never too early, and that goes for health too. So you can start building up those relationships with the younger children. Try to get to see your doctor on a regular basis, not just when they're ill. So it takes the fear away from going into the practice, takes the fear away, demystifies using equipment such as a nebulizer or a blood pressure check or whatever it is that they need to do.
I agree. Mary, any last comments from you?
No, I think that was really well put, and I think that was what struck me, and certainly I fed back to my colleagues within NHS England that wonderful event you both organised in Bromley, where we talked about the fact that perhaps families and carers don't think about going to see the GP when you're well, but actually that's what the health check's about. The health check is about going to see the GP and talking about all the issues and having a review, and the GP understanding what it looks like to be well for the young person, so that when if or when they are not as well, then the GP can understand and see that, and make sure they get the right care and treatment, the right referrals and all of that, and that we eradicate and stop these health inequalities, and that people have much better, healthier lives.
Thank you very much. Well, we've come to the end of our webinar. We've gone over by about 3 minutes. I don't see any final questions coming in.
Okay, Lynn, just Helen here, just to let you know, to share the results of that last poll with everybody. How likely to now ask for a check for your child? 40% are very likely, 40% are likely, 10% unlikely, and 10 for whom it was not applicable.
Thank you very much for answering. Okay, so I'm gonna sign us off now. I'm gonna say thank you very much to Mary and Ros for joining me on this webinar. And if you have any specific questions around annual health checks, my email is at the beginning of the slide, at the beginning of the webinar slides, which will be up on our website in about a week or so's time. So thank you very much for listening, and goodbye.